My name is Jennifer Metcalf. I am a student in the nursing program at Indiana State University. This presentation is for Nursing 444, Community Health Nursing. The part I am focusing on is anyone with children or that is around children. After viewing this presentation, participants will be able to describe situations in which 911 should be called. Describe the questions the 911 operator may ask. Describe when you should hang up the phone after calling 911. Describe what you should do while waiting for first responders. Describe what you should do if you call 911 by mistake. Describe how to explain to children what an emergency is. Describe what to teach children about who they will be talking to and what they should tell them when they call 911. Describe what to tell children about who will come help them when they call 911. Describe how to let children practice calling 911. Describe what to tell children about what is not an emergency and is not a reason to call 911. Before viewing this presentation, please complete the pre-test, post-test that is located in the comments below. After viewing the presentation, please complete the pre-test, post-test again to see what you have learned. Also included in the comments below are the answers to the pre-test, post-test questions, a brochure summary of this presentation, and references where more information can be found. When to call 911. Most people know what 911 is. Not everyone understands when they should or should not call 911. What to do when they call 911. What is going to happen when they call 911, or how to teach their children to call 911. This presentation will go over all of those details. When to call 911. When there is a life or limb threatening condition, the condition could worsen quickly on the way to the hospital. Moving the victim will cause further injury. The person needs medical care right away. Distance or traffic would delay getting the person to the hospital. Some examples of situations to call 911. If someone is having trouble breathing, having chest pain, has a heart rate faster than 120 to 150 beats per minute at rest, having difficulty speaking, having dizziness, numbness, weakness, or new confusion, has sudden blindness or vision changes, bleeding that will not stop, choking, new severe headache, drowning or near drowning, broken bones, drug overdose, poisoning, allergic reaction, seizures lasting more than 5 minutes, severe burns, 2nd or 3rd degree, someone faints or is unconscious, not responding, sudden, intense, severe pain, someone threatens to hurt themselves or someone else. Other times to call 911. when there is a crime in progress, such as a robbery, burglary, fights, etc. When there is any type of fire, such as a building, vehicle, brush, etc. When there is a vehicle collision. When you or someone else feels in danger. If you are unsure if you need to call 911. The 911 operator will decide if it is an emergency. Questions the 911 operator may ask. Location of emergency, the address, landmarks, street signs, or buildings nearby, the phone number you are calling from, the nature of the emergency, such as medical, fire, or crime, details about the emergency, and do not hang up until the 911 operator instructs you to do so. Waiting for first responders. Follow instructions given by the 911 operator. If someone is bleeding, apply pressure to the wound with any type of cloth, bandage, etc. Turn on lights if it is dark so first responders can find you. Unlock doors if you are inside. Have advance directives, power of attorney, or other legal documents ready if possible. If you call 911 by mistake, do not hang up. Explain that everything is okay and there is not an emergency. How to teach children to call 911. Teach them what an emergency is, such as a fire, a car wreck, someone trying to hurt someone else, someone breaking into the house, and someone that is badly hurt, bleeding, will not wake up, or cannot talk or respond. How to teach children to call 911. Explain what 911 is and who will come to help them, such as police officers, firefighters, and EMTs or paramedics. Explain that when they call 911, someone on the phone will ask questions to get information such as their address, phone number, what type of an emergency it is, etc. Tell them not to be afraid to talk because that person will send out the police officers, firefighters, or EMTs to help them. Show them how to call 911 on a phone that is not connected to a phone line. How to teach children to call 911. Teach them what is not an emergency and they should not call 911. For example, a lost pet, a small cut, or a bruise. Teach them to ask an adult if they should call 911. If one is not available or cannot talk, there is probably a real emergency. Explain that calling 911 is not a game and only do it in an emergency or someone could get in trouble. On this slide are the references for this presentation if you would like more information.